The future of healthcare is being built right now. Startups are leading the charge, and they're looking for people like you, people who understand patients, who value quality, and who are ready to think differently about what's possible. So if you've ever felt frustrated by the pace of change in traditional healthcare, this is your chance to be part of something bigger. You can shape the tools, the systems, and the care models that will define the next generation of healthcare. Hey there, and welcome to the second episode of Startup Physicians. I'm Allison Kerfman, and I'm just really excited to have you here as we keep going on this journey together. Last week, I shared with you my personal journey in the startup world and what inspired me to start this podcast. And today, I'd like to walk you through a really practical guide of the different roles that physicians can find within the startup world to help you understand what the variety of options are that could be available to you. So if you're a physician, chances are you've spent most of your career practicing medicine in hospitals, clinics, or private practice. But what if I told you there's an entirely different world out there, one where your clinical expertise can help shape the future of healthcare through startups? So this podcast is for physicians who are curious about the startup world, but don't really know where to begin. So whether you're dreaming about doing what I did and founding your own company, or if you're thinking more along the lines of wanting to consult with innovative health tech startups, or you're just exploring what's out there, you are in the right place. So I wanted to share a little bit about why I'm so passionate about this work. I'm a practicing pediatric emergency physician, and a few years ago, I stepped into the world of startups. I co-founded a company called Imagine Pediatrics, which focuses on care for high-risk children on Medicaid. And it was really an incredible journey, one that completely changed the way I think about healthcare and what is possible when clinicians work hand in hand with other entrepreneurs or become entrepreneurs themselves. I started this podcast because I realized there's a huge gap in resources for physicians who want to break into this space. And I've had the privilege of working in this space for years, and I've seen firsthand how much of a difference we can make as physicians, and whether that's designing safer, smarter healthcare technologies or helping companies understand what patients really need. But I've also met so many doctors who feel like this world is out of reach for them. Many of them come to me and ask if they should get their MBA or if they should get another degree in clinical informatics, or if, think they don't have a good enough business background, or they think they have to have a complete career change to get started. And that's simply not true. So over the course of this podcast, we're going to explore what it takes for physicians to succeed in the startup ecosystem. We'll cover everything from foundational concepts about startups and private equity and venture capital, other things like design thinking and product development, and real-world stories from physicians and startup leaders who've made this leap. So if you've ever felt stuck in a system that's really slow to change, or you're looking for new ways to make an impact, I think you're going to love what we've got planned. So why should physicians think about startups? We all know that healthcare is changing faster than ever before, with AI and digital health tools, all the way to considering new care delivery models. We're really in the middle of a transformation. But the challenge is that so much of this change is happening without meaningful input from physicians. And we really have a very unique perspective on patients and their journey through the healthcare system and what they really need from their healthcare. So think about the last time you had to work with a piece of new technology in your practice, whether it's an EMR or a new device or a new workflow. How often did you feel like it wasn't designed with real clinical workflows in mind? Or worse, that it was actively making your job harder, one of the things that I hear doctors talk about all the time is their EMR inbox. And, someone created that solution to a problem of patients wanting better access or a more convenient way to access their healthcare team. But, some of us wonder, did physicians actually have input on the design of the system? Because, we now have doctors who are just inundated with epic inbox messages from their patients, and it didn't, stop to consider what that does to the doctor's workflow and whether it's reasonable. And so that's just one example of many where we maybe haven't had a seat at the table to develop some of these things. And that's exactly what happens when solutions are developed without a deep understanding of patient care and physician care. And that's why it's so important for us to be involved in startups that are really designing new capabilities and new models and new methods and new technology, because it's going to be coming at a pace that's uncomfortable for all of us. And particularly when I think of like AI models, I really truly believe that we need to be involved to put safeguards on those things. I want to talk a little bit about what are some of the benefits of working with startups. So, one of my favorite things about working in this space is that startups are very nimble. They are not tied down by the bureaucracy of hospital systems, which means they can innovate very quickly. But speed doesn't always equal quality. And in fact, many times it does not equal quality. And that's where we come in. We have the ability to bring a truly invaluable perspective to ensure that these innovations are being developed in an exciting way, but also in a safe, effective, and grounded in real world practice way. And so I think that we have to think differently. It's a different way of thinking than what we are traditionally taught in medical school. And we do have to be willing to challenge the status quo and the way we've always done things. But it's a skill you can learn. And I think that it becomes very meaningful when you realize that you've been able to contribute to something so much larger than yourself. I know that I could never have reached as many patients and changed as many patient lives in my day-to-day practice, seeing one patient at a time, compared to starting my own company. And I think that's really meaningful to know something I contributed to is now making a large impact. So when doctors are interested in getting into startups, I tell them that now is actually the perfect time for this. I have worked with a number of companies that are developing AI algorithms, and they're really making their way into every aspect of healthcare. Population health models are another example of where physicians are very needed. So if you think about different companies that are trying to address a specific population and maybe using value-based care and risk models to manage this population in a different way by providing new resources for them. But they really need physicians to be able to help design those models. And it's really changing how we think about patient care, and more healthcare is moving into the home. And I sense that we will see a lot of that over the coming years. Digital health platforms are scaling faster than ever. And if we as physicians don't step in to help shape these tools, we really risk repeating the same mistakes that we've seen before, when technology is created without our input and then fails to truly serve patients and physicians in the way that we would envision. So when I first started working in startups, one of the most exciting things for me was the energy. In some of the traditional healthcare systems that I had worked in before, I felt like sometimes we would have really good ideas, but it was never feasible to change anything rapidly or make significant changes or even build something from scratch. And the change can feel like it's happening at the pace of an iceberg melting, and it's frustrating. But startups are really different, and they're filled with founders and teams who are really passionate about their mission, fast moving and agile, and completely committed to achieving the mission of the product or company. And being in that kind of environment is not just inspiring, it's also an incredible way to make a real impact in a fast manner. So the bottom line is that the startup world is brimming with opportunities for physicians. So whether you want to help design the next groundbreaking technology or consult on new care delivery models or even build something of your own from scratch, this is the perfect time to get involved. And I'd like to share some of the unique roles that physicians can play in startups. And what's really amazing about this space is there's really no one size fits all path. So you bring a skill set that's very versatile and it's based on your many years of clinical expertise. So, as physicians, we've all gone through medical school, we've all gone through training, and most of us have practiced for a number of years. And that really leads to the lived experience of caring for thousands of patients. And startups really need that expertise in a lot of different ways. So first, let's talk about what the biggest leap would be, and that would be becoming a founder of a company. So maybe you've got an idea that's been brewing for a while, or you think of a solution to a problem that you've faced in your practice, or a way that you see an opportunity to improve care delivery. That's how my journey started. And founding a startup is really not for the faint of heart, but it's also one of the most rewarding ways to create something that could impact thousands or even millions of lives. So that's the path I took when I co-founded and launched Imagine Pediatrics. I quit my job. I moved to a new city. I incubated this idea, and it's now serving over 25,000 high-risk pediatric patients. It's a very bold move, but if you're ready for a significant change, it is an incredible way to make your mark. And I am already created a network of other physician founders who are very bold and willing to take risks. And it doesn't mean if you want to start something, it doesn't mean you have to quit your job. But at a certain point, if something really starts taking off, it does often require a full-time commitment. But not everyone wants to build a company from scratch, and not everyone is really excited about taking that much risk. But another option is to join an existing startup. So you can take a role, the chief medical officer or chief clinical officer. And these roles would really allow you to leverage your clinical expertise without taking on the risks of founding a company. And these positions are really great for physicians who want a full-time role in a startup, but still want to focus on their passion for healthcare. It obviously comes with a lot of responsibility. If it's an early stage company, you still have to be willing to wear a lot of hats. And if you're the chief medical officer, you do have to consider that you are really taking on the liability of basically everything clinical that happens at that company. So you need to make sure that what you're signing on to, you really believe in it, and you believe in the quality, and you believe in your ability to continue to influence that quality, and that you trust the people who are founding the company and investing in the company so that you can be the most successful. So what if you want to dip your toes in the water instead of diving in head first? That's really where consulting and advisory work comes in. And that's what I'm doing now. I am working with a lot of different early stage companies, because my favorite stage is working with companies that are really trying to design and build a new product or model of care, and do what we call de-risking a concept to try and make sure that we're really kicking the tires on the model and really assessing what is needed for this concept or company to really launch. I think it's really fun because you get exposure to so many different people and ideas. And some people may actually be like me and really love talking to people and making relationships and connections. And if you really truly want a consulting and advising practice, it will require a business development pipeline. You will need to work with multiple companies, and you have to be willing to pitch your services. You have to know what your services are. But you can work as a consultant, which is more, in my opinion, someone who's actively doing a project and creating deliverables for someone. You could also be an advisor where you're not a decision maker, but your clinical thoughts and opinions are being drawn upon as they build a product or a service line or something like that. And another service that I provide that some people may not know is an option is to be a fractional chief medical officer. And I call it a fractional interim chief medical officer because I know that based on my experience with Imagine, I loved the early stage, the incubation, the launch, the build, the design. And as we got the whole company up and running and had hundreds of people working there, it really wasn't my skill set or passion to be what we call an operator. And so I found someone much better than me at that work to succeed me as CMO. But that's some of the work that I'm doing now with other companies is to, again, be the interim chief medical officer. And maybe they don't need all of my time. It's not a full-time job, and that's why it's called a fractional role. So maybe they only need a chief medical officer, 0.2 of the time. And the interim intention is that I don't plan to operate these companies long-term, but I want to get them launched. So I can be the face of the company. I can help them pitch. I can help them create medical groups. I can help them recruit the right doctors. I can help them fundraise and get contracts. And so that is another option that is really exciting and doesn't require you to be completely committed to one company. But again, you're taking on liability. And so that relationship would only work if you feel very, very confident in the people and the product that you would be representing. This approach actually offers so much flexibility. So you could do this full time like I am now, or you can keep your clinical job. You could work part-time. You could explore locums. So I do locums at 2 different emergency departments, and that allows me to stay clinical. I actually love seeing patients in the ER still. And so I love being able to talk to parents and still use my clinical skills and stay credentialed. But I'm also able to take on exciting projects in the startup world. And it's perfect for physicians who want the best of both worlds. And there's other options to also take a more passive approach. Maybe you don't want to go pitch a lot and build a BD pipeline. You could also find roles to be in an advisory community. So maybe you don't want to look for consulting gigs by actively marketing yourself, but you're interested in companies that may want your advice. And you can be part of an advisory group or network that people can come to you to participate in high impact projects. You can join advisory boards. A lot of companies have a clinical advisory board, and that is very different than a board of directors. So if you're on a board of directors, you are actually liable for the company and their performance and what they do. But an advisory board, you're not a decision maker. You're really a trusted advisor to look at things they're working on, and they will present you with different things and get your opinion, because a lot of times these are tech companies. They are not physicians or clinicians. And so they really need that expertise. Others will be looking for advisors in their early stage development because they have an idea. They may not have funding yet, but they're trying to determine if it's worth launching. So a lot of private equity funds and venture capital funds will incubate a concept and try and decide, is this something that we want to fund, or is it not going to work? And so they need a lot of advisors to help suss that out. The other role that I didn't mention is that if you have an operating medical group that's a startup that actually hires practicing physicians, those are jobs you can look for too. And I think what's really cool about that is it often allows you to practice medicine in a different way, maybe using more technology or seeing patients in a different capacity, but it has all the benefits of working at a startup. So a lot of times startups are just a very, very different culture and environment, and often will be a lot more modern with their HR policies and benefits because they really want to attract top talent. So that's another option for physicians, is to actually look for jobs to practice medicine within a startup. You have to realize that the risks there are that a lot of these companies aren't really established. So you still have to be able to be flexible and recognize that roles may change, things may shift, and that's, it may not be as stable and predictable as working in a traditional environment. But for me, yeah, maybe working in traditional environment was stable, but the predictability to me really corresponded to the inflexibility to change. And so I love the environment that, even if it's a little more risky, if it's a little less, there's a little more unknown and things change a lot, I find it to be very stimulating. So the beauty of all these roles is that they really allow you to contribute in a way that aligns with your goals, your lifestyle, and your career stage. So if you're ready to take the leap into a full-time startup role, or you're just curious about what's out there, there's really a place for you in this ecosystem. And I want to take a minute to talk about why this is such a critical time for physicians to get involved in startups, and why I started this podcast, because I feel so deeply that there is an important role for physicians, and the lack of pathways to really help educate physicians on how to get into the startup world and how to be successful here is what really inspired me to start this. So the healthcare landscape is transforming at a speed we've never seen before, and it's being driven by new technologies and care models. And I know I already talked a little bit about AI, but what is AI really good at right now? It's really good at language models. So if I want AI to even write a poem for my kids, it can do that. But would you feel comfortable with ChatGPT deciding on diagnostic testing for your patient, or maybe a treatment plan? I don't know about you, but I have asked AI things in the past where it flat out makes up an answer. I have asked it for something that has a very specific answer, like a publication or a grant to reference, and it made up something that sounded really great and very relevant, but it was totally baloney. And so I absolutely would not trust AI algorithms at this point to be able to make any sort of clinical decisions on our patients. But trust me, people are developing it. So there are so many tools being developed for any little corner of medicine, any little piece of something that has been a problem or been costly of funding or time in the past. I guarantee you someone is looking at it. And so I personally don't feel comfortable at all with a robot making decisions about, what sort of antibiotic a kid should get. But AI isn't inherently good or bad. It all depends on how it's designed and implemented. And so that's where we as physicians come in, and we have the expertise to see unintended consequences that others might miss. And we know how to build in the guardrails for safety and quality that align with real world patient care. And so I find that my role as a consultant or advisor or fractional CMO is often to infuse safety into a model. So as an ER doctor, I'm constantly thinking about, what's the worst thing that can happen? What's the worst thing that could happen in this situation? What's the worst thing that could happen if we saw a patient in this way, or deployed this technology, or created this messaging platform? And, you have to be able to think that way to be able to make sure that it doesn't happen. And I think that you need not only, a physician's perspective on these things, but many physicians' perspectives. And that's part of the process of developing a product, is that you have to get a lot of perspectives. And so you want a lot of people having eyes on the product to give individual feedback from a different perspective. So I think that AI platforms, whether it's for insurance prior authorizations, trying to optimize that, if it's trying to optimize hospital workflows. I've a friend who works for an AI company, and they do something called digital twinning, where they create a digital twin of an entire hospital, which is kind of hard to understand, but it's basically mimicking all the digital footprint of a real world healthcare system. And it runs algorithms to look for ways to operationalize or increase efficiency. So it will find bottlenecks in the system based on just the digital side of things. And before they implement solutions for suggested changes that would work better, there's a lot of really exciting things to contribute to. And sometimes, the things we know as doctors, we don't realize that other people don't know them. And because we just think it's such common knowledge, but it's not. It's from your clinical expertise and your background as a physician. And so one of the most important early steps that I had in designing the Imagine clinical model was really describing to my firm how these patients move through the system and creating what we call a patient journey and identifying where the barriers are. So there's a lot of opportunity there with AI companies. Another example is the rise of digital health platforms, which may seem like old news now that all these things are commonplace after the pandemic, but many of these tools have the potential to make care more accessible to patients, more efficient, but only if they're designed with the realities of clinical practice in mind. And too often we see that technology that may look really innovative on paper actually creates more problems than it solves because it wasn't built with the input from the people who actually care for patients. Another piece is population health models and care delivery systems. So there's so many companies that are reshaping about how we think about delivering care to large groups of people and really focusing on outcomes and preventative measures. So Imagine Pediatrics is a population health model for children with medical complexity on Medicaid. There's other companies that focus completely on patients with heart failure or patients in rural settings or other groups of patients that have specific barriers to accessing healthcare in a meaningful way, or maybe have really high cost of care and poor outcomes. And so these companies need physicians to design these models and help predict what will work and really address gaps that only we can see. So the reality is that if we don't step up, these solutions will continue to be developed without us. And when that happens, patients and clinicians are the ones to suffer. But the good news is that startups are really hungry for physician input. They really want our perspective, our experience, and our ability to connect the dots between innovation and practicality and safety. And we have a chance now to shape the future of healthcare in ways that serve patients and physicians. So if you're wondering if there's a place for you in this space, the answer is absolutely yes. There's a whole spectrum or continuum of ways you can get involved, and healthcare startups need us more than ever. And the only question is, what sort of an impact do you want to make? Today, we've talked about why startups need physicians, the different roles you can play, and why now is the time to get involved. But I'd like to have some practical takeaways from today's episode. So first, I want you to know you don't have to have all the answers right now. I truly don't think you need an MBA or another degree. You don't have to be a business or finance expert. And what you need is curiosity, a willingness to learn, and the confidence to know that your clinical expertise is actually very valuable. And your ability to see the bigger picture, anticipate patient needs, and identify potential risks is exactly what startups are looking for. You may not realize it, but skills you use every day as a physician, critical thinking, problem solving, and decision making under pressure, are actually the same skills that can make you an indispensable part of a startup team. Second, I want you to start thinking about where you see yourself on the spectrum of involvement. So are you interested in building something from scratch or consulting and doing advisory work? Or maybe you're curious about this world, but you don't know where to start, and that's okay too. Finally, I want to leave you with this thought. The future of healthcare is being built right now. Startups are leading the charge, and they're looking for people like you, people who understand patients, who value quality, and who are ready to think differently about what's possible. So if you've ever felt frustrated by the pace of change in traditional healthcare, this is your chance to be part of something bigger. You can shape the tools, the systems, and the care models that will define the next generation of healthcare. And there's really nothing more rewarding than seeing your expertise make a very tangible difference. Here's what I want you to do. If this episode has sparked even a little bit of curiosity, subscribe to this podcast so you don't miss what's coming next. And please share this with your colleagues who are also looking for something new. And if you're ready to dive deeper, please check out the resources that we've created for you at startupphysicians.com, which is our community that's here to support you on this journey. So thank you so much for joining me, and I can't wait to see you next week.